or just a few more seconds, but we are pleased to introduce Laura Beilke from Triage Cancer. She's here to talk with us about managing finances after a cancer diagnosis. Laura is a staff attorney for Triage Cancer. Laura earned her Juris Doctor from Brooklyn Law School and her Bachelor of Arts in Neurobiology and Psychology from the University of Wisconsin-Madison. Laura is a member of the State Bar of Wisconsin. Having experienced the loss of her mother to cancer at a young age, Laura is driven by a desire to leverage her legal expertise and background to make a positive impact within the cancer community. Laura, we are thrilled to welcome you to the exchange, and we look forward to learning from you today.
Well, thank you, Julie. Let me just get my presentation up. Perfect. So, hi, everyone. Like was already said, my name is Laura Beilke, and I am a staff attorney for Triage Cancer. And I was invited here today to discuss the financial impact of a cancer diagnosis, some different strategies to help minimize out-of-pocket costs, and places to look for assistance if needed. And as I'm only going to be here for a short period of time today, I do want to first start by telling you a little bit about Triage Cancer and where you can go for more information on these topics and more. So, like I said, I'm a staff attorney at Triage Cancer, and Triage Cancer is a national nonprofit organization that provides free education on the legal and practical issues that may impact individuals diagnosed with cancer and their caregivers. And we get this question a lot when we tell people about what we do at Triage Cancer and that we are cancer rights attorneys. And the question is, what is legal about cancer? But the answer is actually quite simple, and it's almost everything. Laws can be why a certain cancer drug is approved by the Food and Drug Administration. They can protect people from discrimination and provide health insurance access. It can also create certain government benefits or provide funding for screening, treatment, and research. So when we talk about what is legal about cancer, we really mean almost everything. And because of this, Triage Cancer has a whole host of resources that are available to everyone and can be found on our website, triagecancer.org. And these resources will include things like our quick guides, checklists, animated videos, and much more to help you navigate these systems. And to make it easier to find what you are looking for, we do organize our resources in different ways on our website. So one way that we do organize them is by topic. And once you click on a topic you're interested in, you will be directed to all of our resources specific to said topic. And it's a great way to find out more information in a specific area that you might have questions on. We also organize our resources by location. So we do have state-specific resources, which include the contact information for useful agencies and programs in your area. We also have our charts of state laws, which show you the different protections and benefits that you have access to based on where you live. So I'm here today to talk about the financial impact of a cancer diagnosis. And in 2013, researchers at Duke came up with the term financial toxicity to describe the long-term negative impact medical expenses can have on patients in terms of their health-related quality of life. But even though we have been talking about financial toxicity for more than a decade now, the reason that has been so hard to solve is that there are a lot of contributing factors to financial toxicity. And like many different areas in our life, there isn't a one-size-fits-all solution. At Triage Cancer, we do think that the number one contributing factor to financial toxicity is having inadequate health insurance. But it is also important that people understand how to use their health insurance effectively and not pay more out of pocket than they need to. So before I start to go in with the different options about health insurance and ways to minimize our out-of-pocket costs, I do want to talk a little bit about why it's important for health insurance. And having effective health insurance is extremely important, but there are many times when our health insurance is just not working for us. And the problem is health insurance is just so complicated that Americans simply do not understand how it works or how to choose a plan. In fact, only 4% of the people surveyed in one study could define the terms used in a health insurance policy. And now, one of the reasons that finding the right health insurance can be so challenging is that to be a truly informed consumer, you essentially have to learn a whole new language. And we know from multiple studies out there that Americans just do not understand health insurance. And we understand why that is. But I do want to just put you at ease that if you right now feel like you really do not understand health insurance as well as you want to, you are certainly not alone. But hopefully after today, you will be a part of those 40% of Americans who are very confident in choosing the right health insurance plan for them. So I do first want to talk a little bit about the most frequently misunderstood terms, because like I said, understanding health insurance can be like learning a whole new language. And even if you do know these terms, that is great, but this will all give us a really good starting place to build on together. So first, I want to talk about the premium, which is a cost an individual pays each month just to have their health insurance, even if they never receive medical care. But then there are the costs and terms associated when individuals do receive care. So the first is the annual deductible, which is a fixed dollar amount that someone will have to pay out of pocket first before their insurance will even kick in and start to pay for their medical expenses. This could be a $500, a $5,000, maybe even a $0 deductible. It's just going to depend on the type of coverage that you have. Then there is a copayment, which is another fixed dollar amount to get certain types of care. And I like to think of the copayment as an entrance fee because you're typically going to pay this at the time you go and get your care. So maybe you're going to your primary care physician and have a $10 copayment. Or maybe you're going and seeing a specialist and have a $30 copayment. And then there is a coinsurance, also sometimes referred as a cost share. And this is the difference between what our insurance company is going to pay for our medical expenses and what we are going to pay for our medical expenses. So maybe we have an 80-20 plan, and this means that the insurance is going to pay 80% of our medical expenses, and we are going to be responsible for 20% of our medical expenses. And then lastly, I want to talk about the out-of-pocket maximum, which I would argue is probably the most important thing anyone should know about their policy. Because in a worst case scenario, it is the most that you're going to pay out of pocket for your medical expenses during the year. Now, the out-of-pocket maximum is also a fixed dollar amount. So you might have a $1,000 out-of-pocket maximum, or you could have a $20,000 out-of-pocket maximum. Again, it's going to depend on the type of coverage that you have. And because I just said out-of-pocket maximums are so important, and it's really important to know how they work, I do want to go over an example of how an out-of-pocket maximum actually works. So I would all like to introduce you to Dan. Dan has a policy that has a $2,000 deductible. It is an 80-20 plan, and he has an $8,000 out-of-pocket maximum. Dan unfortunately had an emergency that required him to go to the hospital, and this hospital visit resulted in a $102,000 hospital bill. So let's assume that he has no other medical expenses during the year. How much does Dan actually have to pay for his medical bill? So first he has to pay his $2,000 deductible, which leaves $100,000 left of the bill. But he has that 80-20 plan, so he's going to be responsible for $20,000 because that's 20% of the $100,000 bill. But remember, he has that $8,000 out-of-pocket maximum, and he's already paid his $2,000 deductible. So he actually only has to pay another $6,000 of that $20,000 bill, and then he'll have reached his out-of-pocket maximum, and his insurance will kick in and pick up the rest of the $20,000 bill. And I do want to note that if you want to hear this example again or go over the health insurance terms again, we do have that information included in our animated video on health insurance basics. So now that we have a good understanding of the basic terms in health insurance, where do we go and get our health insurance coverage? What are our options? In the United States, there's only 3 places where we get our health insurance coverage. We're either getting it directly from the insurance company, or we're getting it through the government. And by that, I mean like Medicare, Medicaid, military veterans plans. But about 50% of people in the United States still get health insurance coverage through their employer. And at Triage Cancer, we do think that it's important that individuals understand all of their options so that they can figure out the best option for them. And because of that, we do have a wide variety of resources on our website about different types of health insurance options, how to compare those options, and also how to use your insurance effectively. But today I'd like to focus on a couple of key ways that people can keep their health insurance and also lower their costs. So one example of the government-funded health insurance is Medicaid. And while this is a federally funded program, states run the Medicaid program for their specific state. And unfortunately, when we're talking about Medicaid, Medicaid is very, very, very state specific. States are very much allowed to have flexibility in how they design their Medicaid programs. So they very much are differing across state to state. And I am going to give you an example of how that is. So prior to January 1st of 2014, Medicaid was the federal health insurance program where you had to have a low income level, a low resource level. And by resources, I'm meaning your assets like or money that you have included in a checking and savings account, the cash value of a life insurance policy. And by low resources, I do mean low, like only $2,000 in assets. And besides meeting that low income level and that low resource level, you also had to meet some other category of eligibility. In the cancer community, most often, people could get access to the Medicaid program through the Age, Blind, and Disabled program, which I acknowledge is not a great name for a program at all. Plus, the door had a lot of hoops to jump through because it effectively meant that you had to go to the Social Security Administration, apply for supplemental security income, get approved for that program, and then in most states, you automatically would qualify for Medicaid. So there were a lot of barriers to actually getting access to this type of health insurance, which is one of the reasons why the Affordable Care Act created a fifth door of eligibility. And this door is just based on household size and household income. There are no assets, no resources, and no other category that had to be met. So for individuals who had incomes at or below 138% of the federal poverty level, they would be eligible for Medicaid. Unfortunately, this fifth door of eligibility is not a requirement that all states have, so meaning that they haven't expanded their Medicaid program. So depending on the state you live in, you might not have access to this fifth door. Another way that you may be able to access health insurance is through the health insurance marketplace. And we like to think of the marketplace as a virtual shopping mall where the only product someone could shop for is private health insurance plans. And this is where you could go and find what plans are available in your area. Plus, you could also use the marketplace to find out if you qualify for Medicaid in your state. There are a number of benefits to shopping for coverage through the marketplace. And one of the benefits is that this year, no plan on the marketplace can have an out-of-pocket maximum higher than $9,450 for an individual plan or $18,900 for a family plan. And I acknowledge that those numbers are high, but they can be even higher if you were purchasing off of the marketplace. Plus, the marketplace does ensure that there are some limits to what you'll actually have to pay for your medical care. Plus, depending on your household size and your household income, there are actually two types of financial assistance that may be available to help make these plans more affordable as well. So the first type of financial assistance is called the premium tax credit. That's going to lower the monthly cost of having your health insurance. So it's going to lower your monthly premium. And then the second is a cost sharing subsidy that lowers out-of-pocket costs for certain plans once you have them. And I do want to note that something about marketplace plan costs is that people often assume that a marketplace plan will be really expensive, but these plans can actually be much lower priced than what people expect. And that's because people don't understand that there are these financial assistance options to make them more affordable for individuals and households. So I do want to just go over what it looks like for the financial assistance based on income level if you are in a state that has that expanded Medicaid, meaning you have that fifth door of eligibility. So if you have household income up to 138% of the federal poverty level, you have access to Medicaid. If you are between 138 and 250% of the federal poverty level, you have access to both the premium tax credits and the cost sharing subsidies if you pick a silver plan. And if you're between 250 and 400% of the federal poverty level, you have access to the premium tax credits. Now, if your household income is over 400%, you can still buy a marketplace plan. You just might not qualify for the financial assistance explained here. There are just a few other requirements that would need to be met. And there is even more financial help now available to help people afford a health insurance plan on the marketplace. So overall, 4 and 5 healthcare.gov customers, which is the federally facilitated marketplace plan. So those 4 and 5 customers were able to select from a healthcare coverage options that were $10 or less per month. And even those who made 400% or more above the federal poverty level may be able to access that financial assistance as well. Unfortunately, for the 400% financial assistance, we only know that's going to continue through 2025. Things might change, but this is all we know for right now. And before we move on how to compare these health insurance options, I do want to quickly mention the programs out there to help with the cost of Medicare, which is another government-funded health insurance. So Medicare is health insurance that is available to those who are 65 and older, who have been receiving Social Security disability insurance benefits for 24 months and or have end-stage renal disease or ALS. And there are some programs to access for help paying for Medicare, especially if someone is trying to deal with the out-of-pocket costs for Part A and Part B. Collectively, these programs are called Medicare savings programs, and there's actually 4 different programs within this. They all have different requirements that are based on your income level and resources, and they each have different types of benefits that they're going to help with. If you would like more information on these programs, we do have an entire quick guide on Medicare savings programs that you could access through our website. Now, if someone is struggling with out-of-pocket costs under Part D prescription drugs, there is something called the Low Income Subsidy, also known as LIS or Extra Help. And this program can help pay the premiums, the deductibles, and co-payments for prescription drugs. Some states also have something called a state pharmaceutical assistance program. Not every single state has one of these programs, but we do have a link on this slide so that you can go and check out what is available in your states. So with having multiple options for health insurance coverage, it is important for individuals to compare these health insurance plans to ensure that they are getting a plan that is meeting or that will meet their needs. This could be comparing a COBRA plan to a marketplace plan, or maybe one marketplace plan to another marketplace plan. This is particularly important as we hear from people who are frustrated by their insurance costs because they only look at the monthly premium when they're picking a plan, but the lowest monthly premium does not always equate to the lowest cost. So like I said, looking at just the monthly premium can lead people to spending a lot more on healthcare than they understood that they would. So here on this slide, we do have 3 plans that are available to a person on the marketplace. But remember, the process of evaluating a plan is the same for other types of health insurance as well. So just by looking at these 3 plans, can we actually tell which plan will be more cost effective for the year? And the answer is no, we cannot. Instead, you actually have to do some math. And by the way you do, or in the way you do that math is to take the monthly premium and multiply it by 12, because that's how much it's going to cost to have the plan for the year. And then we're going to add to that the out-of-pocket maximum, because that's the most an individual will pay out of pocket for medical expenses during the year. So in this example, it actually turns out that the platinum level plan ends up saving someone almost $2,000 over the course of the year, even though we do get a sticker shock when we see that monthly premium and it seems so much more expensive. But that's mostly because people do not understand how an out-of-pocket maximum work, and they aren't taking that into consideration when they're shopping for health insurance coverage or comparing their options. So doing the math is incredibly important, but getting a plan that will meet an individual's needs isn't just about cost. We also need to look at whether or not the plan covers the providers that we're going and seeing, the facilities that we're going and getting our cancer treatment at. We also need to see if our plan is going to cover the prescription drugs. And I realize that that might sound obvious, but it's often not obvious. And we get a lot of calls from people who are very frustrated with the plan they purchased on the marketplace and that it doesn't cover anything. And after speaking with them, we often find out that the plan they have doesn't cover their providers or the medication, and it quickly becomes really expensive for them. And so it is really important to be considering all of these factors when comparing plans. And this may seem very time confusing, or time consuming, sorry. But in the long run, it could end up saving you a lot of money in medical expenses over the year. So this was a very, very brief overview of your health insurance options and picking an effective plan. So we do have a lot of resources on our website to help you navigate this, and including our health insurance comparison worksheet, which can help guide you through the math like we did in our example previously. Unfortunately, even if you pick a plan that works best for you and it's meeting your needs, there is typically going to come a time where your health insurance company denies a claim. And it is really important for you to know you don't have to take this no as the final answer. Individuals will typically have two rights or opportunities to appeal this initial denial. So the first opportunity or right you will have is to do an internal appeal. And this is where you're going to ask the health insurance company that you have your health insurance through to ask them to reconsider this denial. It is really important to follow the process of your health insurance company with this, because there typically are going to be deadlines and specific forms that you will need to send in. So it is really important to follow that specific process. Now, you're also going to have a second opportunity to appeal, and this is an external appeal. And this external appeal is going to take the decision out of the health insurance company's hand and put it into an independent decision maker. And whatever this independent third party decides is binding on your health insurance company. So if the external appeal decides that your health insurance company should have covered your medical claim, now your health insurance company will have to follow the external appeals decision. And you might again be asking, why am I adding just more steps for you to take throughout this whole process? But there are studies out there that show that 40 to 60% of appeals were found in favor of the patient, not the health insurance company. So that is telling us that about 50% of the time, the health insurance company is getting this decision wrong. And even though appealing a health insurance denial is so incredibly valuable, unfortunately, consumers are rarely ever appealing their denied claims. So more than 99.8% of all denied claims never get appealed. And when we're talking about access to care and financial toxicity, this is a hugely underutilized tool that we have in our toolbox. And for that reason, Triage Cancer really emphasizes appealing denials. And because of that, we do have a whole host of health insurance appeals resources on our website, including quick guides, appeal tracking forms, and animated videos. So once you've received care, you're going to also receive some medical bills, and you're likely going to get a ton of correspondence. So just from your insurance company, you could get 3 different pieces of mail. One saying that they have received a claim, one saying that they're processing your claim, and one called an explanation of benefits, also referred to as an EOB. And you can usually tell an EOB because it will say in large letters somewhere, this is not a bill. but this will give you a really good idea of how much you're going to have to pay out of pocket for this specific claim. Now, these EOBs can be a bit challenging to decipher, so I do want to walk through an example of an EOB. Now, every insurance company is going to present this information in a slightly different way, but generally they should all have this minimum level of information. So the first telltale sign on an EOB is that somewhere on this form will appear the words, "This is not a bill." You will also be able to see some information about the policyholder and who the claim is for. You also get some sort of summary of the claim. And now in the chart, you'll start to see more information about the specific services. So you'll see the date of service, description, possibly a CPT code, information about the amount billed and the amount not covered. And this amount not covered is sometimes about the difference between what the provider billed and what the insurance company has contracted with them to pay for certain services. And then in the last part of this chart, we'll show the coinsurance amount and what someone will likely owe their provider. Lastly, EOB should somewhere indicate how much you will have paid towards your deductible for the year, how much you have paid that has been applied to your out-of-pocket maximum for the individual and also for the family if you have a family plan. And as I talked about before, keeping an eye on that out-of-pocket maximum can be really, really helpful. Unfortunately, we are not done with the paperwork you will receive. You will also get a bill directly from your provider, and this could be the hospital where you get the care, from your doctor's office, or maybe from a lab company. But the challenge with all of this and all these pieces of communication from the insurance company and the provider is that they may all be sent in different manners, like physically in the mail, sometimes it's an email, sometimes it's only in your patient portal. And also, they don't always come in the exact order that we've been talking about them in. Many providers are, in fact, faster than the insurance company at sending the bill than the insurance company is at processing the claim. So it is really important to keep track of all these pieces of communication and to make sure that you're comparing the EOB before you're paying any bills. And if you are waiting for that EOB before you pay, it can be really helpful to communicate this with your provider so that they don't think that you aren't planning on paying the bill. It's also a great time to ask questions if maybe there's any discrepancies between the EOB and the bill, if you're confused on why you're being charged for this specific service. This could also be a great time to see if you qualify for hospital charity care, which is a type of financial assistance through certain hospitals. And Dollar4 is this great organization that can actually help with identifying the hospitals that have charity care, the eligibility requirements for it, and they can also help apply for charity care. And of course, lastly, appeal any denials you might have received. Now, if you are in a situation where you do owe your healthcare providers, try talking with them. And we do suggest doing this before they turn over your unpaid bills to collection agencies, which can help to protect your credit. Also, if you can't make a payment, you could ask for more time. You could check to see if they would be willing to negotiate a payment plan or maybe even accept a lower lump sum payment. And the motto we like to remember here is, it can't hurt to try. But even if everybody's done all the right things, there still maybe not enough money to go around. And that's where financial assistance comes into the picture. And there are different places to look for financial assistance. This could be public assistance programs through federal, state, or local governments. For example, Supplemental Nutrition Assistance Program, or SNAP, which is what most people probably know as food stamps. So it provides some type of food assistance for you. Or maybe it's temporary assistance for needy families, or sometimes also referred to as TAMF. And this is what we generally think of as general assistance. And it is essentially cash assistance for families that have minor children. Individuals could also look at other cancer organizations and private programs that offer support. And with these organizations and programs, they generally have less strict eligibility requirements compared to public assistance. And additionally, it can be helpful to look at these specific programs and what specific requirements as to where their assistance goes to. like medical and prescription assistance or medical and prescription expenses, transportation to and from medical appointments, or maybe they offer general aid that can be used for rent, utilities, food, clothing, wigs. We do have a tool called our Cancer Finances, where we have different modules that provide information about different areas that impact your financial situation. And one of the modules that is most popular is our financial assistance module. And through this, we've tried to take some of the research work out of it for people by collecting information about the many cancer organizations and private programs out there that provide grants to people or families impacted by a cancer diagnosis. And with this module, it can be really helpful to be creative when you're looking through it. Maybe you're specifically looking for transportation assistance, but you appear to not be eligible for any of the programs that you have found, but you see that you are eligible for utility assistance. Then you could use that money you freed up from your utility expense, and you can now put that towards any of your transportation expenses. So it can be really helpful to not be too focused on the one type of assistance you have identified for yourself. So I do really encourage people to play around with our Cancer Finances page. And if you are interested in learning more about today's topic or other ones, I do want to invite you to attend our free Triage Cancer Conference. These are 2-day events open to everyone, and they are hosted online, so you can join from anywhere. We're going to cover key information on how to navigate the practical issues, minimize the financial burden of a cancer diagnosis, and help reduce stress. We do have one upcoming at the end of October, and you can register for the conference at triagecancer.org/conferences. And we also host a monthly webinar series open to everyone. We do cover a variety of topics. So they can be really helpful to get a more in-depth on a specific area. And if you are not able to participate in a live webinar, we do record all of our webinars and you can access them on our website. And then lastly, we do know that everyone's situation is different. So if you do have questions about your specific situation, you can contact us through our legal and financial navigation program. And through this program, you are able to have a one-on-one call with one of our staff attorneys where we'll try to explain your options, help go over the pros and cons of different next steps, and hopefully help you take those next steps. You can go on triagecancer.org/get-help, fill out an intake form, and then schedule a call at a time that works best for you. And we do also offer this program in Spanish, where you can speak with one of our Spanish-speaking attorneys. And I am happy to answer any questions if anyone has any. And I will also stop my share.
Thank you so much, Laura. That was really great.